Oh, you muted it, so I'm gonna.
Yeah, I was unmuted and then I muted
Yeah.
myself. Morning, how's it going?
Now I can hear that.
How are things?
Yeah. So, I'm from UK Edu Center, so I'm going to do some little interpretation during your presentation.
Okay,
So I may interrupt you, yeah, like in the middle of your explanation. So please
oh,
set up properly.
sure. So is the best thing for me to do just to kind of stop every couple of sentences? Would that be the best way? Would that make life easier for you?
I will just chat in Korean in the chat room. So I'm gonna just interpret what you say, yeah, in your presentation.
Okay, so are you happy for me just to go ahead then when I'm...
I think,
Okay,
yeah, that's the best way to do. Yeah, and
okay,
I'm going to introduce myself first. I'm going to introduce you first, and then you can go
sure.
ahead. Yeah.
Okay, no problem.
예. 그래서 이제 두 번째 세션은 이제 퀸스 벨파스트 유니버시티라고 노드 아일랜드에 있는 학교에 있는 약대 교수님 댄 코버트 교수님이 이제 참가를 해주셨고요. 제가 아까 첫 번째 세션 때 하면서 좀 중간에 끼어들어서 설명을 해드리려고 보니까 좀 어렵더라고요. 그래서 방금 이제 저희 다른 직원분께서 해주신 것처럼 채팅으로 교수님이 하시는 내용 중에 중요한 내용을 한글로 좀 적어드리도록 하겠습니다. 그러면 프레젠테이션 보시면서 이 내용이 뭐였지? 그럼 채팅을 한 번 더 확인을 해주시면 좋을 것 같아요. Yeah, I'm going to explain. So you can share your presentation.
Okay, great stuff. I'll do that now. Okay, so you can hopefully see that now. If anybody has any issues seeing that, let me know, but hopefully it's all appearing okay. If anybody does have any questions, we can certainly chat about those after the presentation, which hopefully won't take too long. I'll try and move through things quite quickly. So yes, just to go through again, my name's Dan. It's nice to meet you all this morning here in Belfast. So the sun is just starting to come up here in Belfast. I know it's a little bit later where you guys are. I am a senior lecturer in digital education at the School of Pharmacy here at Queen's University Belfast. I'll talk a little bit more about that later as we move through the presentation. But what I want to do today is to spend a little bit of time talking about the MPharm and the BSc programs that we have at the School of Pharmacy, a little bit about careers in pharmacy and the pharmaceutical industry as well. So we'll hopefully go through this. It will hopefully make a little bit more sense, explain a lot more about what we're doing here at Queen's University Belfast. But we will have an opportunity to chat and talk about some questions that you might have at the end of everything here too. So I thought I would start with pharmacy, which I know lots of you are interested in. Talk a little bit about careers that are there, talk about how to get started, and then we'll start to think about the course at Queen's University Belfast then also. So you probably already have a bit of an idea in your minds already about what a pharmacist does. And as I'll mention in a few slides time, that's changing within the UK and it's changing globally as well. And pharmacists who were already very, very important healthcare professionals are starting to become even more crucial to the healthcare sector and caring for patients. And there's lots of reasons for that. So pharmacists, in terms of what they do, we generally refer to them as being the experts in medicine. So we know everything that there is to know about medicines, and that will go from the molecular basis of how they work at cell receptors, very, very, very tiny, minuscule interactions, all the way through to how we can make a patient better for the rest of their lives for the case of some conditions. So that will mean that we understand the chemistry, the biology, and the use of medicines, as well as lots of other important things. And that use of medicines can relate to things like simply how to take them and the best way to take them. And some medicines are very easy to take. You'll all have taken a tablet at some point, I'm sure. You take it, you swallow it, you forget about it, it makes your headache better, whatever it might be. But some medicines are really, really difficult to use. You might have an inhaler to help you breathe, or you might have an injection or a device that will help you to use your medicine. A pharmacist will know how to do all of those. And in addition to that, they will also know how medicines can be used safely because of how they might interact with other medicines that you might be taking, how they might make certain conditions worse that you might have already before you have a new diagnosis. So we're the experts on how to use medicines effectively and safely. Pharmacists also diagnose conditions quite a lot as well. So in the UK in particular, and it may well be the same in South Korea as well, we will have lots of pharmacists working with patients for the first time before they speak to a doctor or a nurse or a dentist or another healthcare professional. Because pharmacists know the questions to ask, they understand lots and lots and lots of medical conditions and can diagnose patients really effectively. Lots of the time, pharmacists can help with those conditions, they can provide medications and advice and support, but also in other cases, they can refer that patient on to the next best person. So maybe on to a doctor or a specialist or to a dentist or some other healthcare professional, depending on the condition that you have. We're also pretty good at communicating. We have to be because we need to provide our patients with lots of advice and information about their health conditions, but also the medicines that they're going to use. So we will be speaking to everybody in society, everybody in our communities, from very young children through to very old members of the community. And how we communicate with them is very, very different. And also, we have to remember that not everybody is as bright or as sharp or as intelligent as all of you guys are. And that means that it can be difficult to explain to somebody what's happening with their condition, how their medicine actually works. So you have to be able to communicate that effectively to our patients as well. So, believe it or believe it not, pharmacists are there not to provide medicines for the rest of your life, but to provide medicine so that you can get better as quickly and as effectively as possible. And a pharmacist's real goal is to make sure that somebody doesn't take any medications unless they absolutely have to. So, that will also allow us to provide good general health advice. There are many conditions that patients have that can be improved simply by changing lifestyle or by improving their health in different ways. And in many cases, that can allow patients to stop taking medications for certain conditions. And pharmacists are the experts on doing that as well. So if we can help a patient to change their lifestyle so that they can stop taking a medication, then that's great. But obviously, that isn't always possible depending on the type of condition that a patient has. So, generally speaking, then, pharmacists are there to make sure that a patient can get the most benefit from their medicines. And that really centers around all of these key points that we've talked about on this slide. So, why would you want to actually be a pharmacist? In addition to what we've just talked about already, where pharmacies and pharmacists are critically important to patient care, but there are lots of really exciting and interesting careers that you can enter into if you have a pharmacy degree and your professional training. And that will start from community pharmacies, pharmacies that might be in the community at the end of your street in your local area, as well as pharmacy services within hospitals. So pharmacists will work with patients in hospitals very regularly also. But there are lots of other jobs within regulation, and that can be within pharmaceutical companies, it can be within governments, and also through to things like academia as well. Many of the staff you'll speak to from the School of Pharmacy at Queen's and other schools of pharmacy will be pharmacists, but they'll also be academics doing research into how we can use medicines better and advise patients more effectively. So, if you work as a pharmacist, if you're a professional pharmacist, there are lots of benefits to this. You can help people to make their lives better, and that's a really, really nice reward to have with your job. Also, pharmacists aren't going anywhere, and as I've mentioned already, pharmacists are becoming even more important now in healthcare. So, there's not another healthcare professional out there who can offer the same expertise and advice and experience that we have, and that means that pharmacy will always be a core part of healthcare. So there's really great job stability and you can plan ahead for a really successful career. You'll have the opportunity to use lots of skills and you can find careers then that match your goals for your career as well. So if you really want to work with patients all the time, you can do that. If you want to work in government, for example, giving advice on how medicines can be used more safely at a country or population level, you can do that as well. So there are lots and lots of opportunities for you out there, both directly within pharmacy, but also outside of pharmacy too, because you will have the skill set to allow you to work in lots of different sectors. So, as I've mentioned, and this is where we'll start to talk about the pharmacy degree a little bit more, over the last few years in the UK, pharmacy has started to see lots of big changes. And You've probably been waiting for me to mention COVID over the last 10 minutes, and it took me just under 10 minutes to get there. But COVID had been a big driver in how pharmacy has changed within the UK and across the globe. And people have realized now that pharmacists are in a really good position. They're really highly skilled and they have the expertise to not just do all of those things that I mentioned earlier, but also to prescribe medicines for patients in the same way that a doctor might do. So the M.Pharm degrees in the UK and including at Queen's University Belfast will now no longer just allow you to qualify as a pharmacist in the same way that I would have qualified a few years ago and dispense medicines, but you will now be able to have independent prescribing rights at the end of your training. And that's a really big, important, and exciting difference to what we would have seen in pharmacy previously. So because of that now, your pharmacy training will have a bigger emphasis on these things that we can see here. So person-centered care, looking after patients, which makes sense. Using your science in practice. So how we'll teach the science content that we teach you actually helps patients at the end of the day in terms of using their medicines and preventing some of those interactions that I mentioned earlier on. Making professional judgments, so making the best selection of a treatment for a patient to manage their condition. And sometimes it might not be picking the general best impression medicine that you would normally use, but using something else that might suit that patient better. Management of risk is important to that too, so making sure that you don't put your patient at risk of harm and making sure that you do what's right for them. And because we're prescribing for patients now, we'll focus even more on that diagnosis and interaction and communication with patients so that we can more effectively treat their conditions. And further to all of that, we need to make sure that we can understand equality, diversity, and inclusion. So patients from different parts of the globe, from different backgrounds, from different religions, might have different restrictions or things that we need to consider when we're managing their care. And that means as a pharmacist, you have to be able to take care of all of that as well. Pharmacy degrees now will have a much bigger amount of experiential learning, otherwise known as work placement, as part of the degree now too. And at the moment, you can expect to be out for at least 12 weeks of placement in community and hospital pharmacy as part of the M.Pharm degree at Queen's University Belfast. So if you're interested in being a pharmacist and studying at Queen's University Belfast and getting all of your training, how do you actually get there? Let's talk about that for a few minutes. And the first step, like we're talking about this morning, is to actually enter onto the M.Pharm program. And we'll talk a little bit more about that in a second. But let's assume that you've done all of that and you've met all of the requirements and you enter onto the M.Pharm program. The M.Pharm program is a 4-year Masters in Pharmacy or Master of Pharmacy program. So that's a little bit longer than other degrees that you might have looked at, which are normally 3 years in the UK. But this course will be a 4-year undergraduate master's. So you'll graduate with a master's degree at the end of this. And what you can see here is a summary of what you'll cover in each of the levels of the M.Pharm course. So in level 1, you'll see here that there's lots of fundamental, important, core content that will allow you to do really well throughout the rest of the degree. So for the first couple of weeks of term, you'll be working with me on skills development, how to get all of those basic skills that will allow you to do really well across level 1 and throughout the rest of the course. And then we'll work with you on fundamental science around chemistry and physiology and physicochemical studies, as well as microbiology and other aspects as well. And we'll also introduce you to the core important parts of working as a pharmacist and being a professional. And what you can see then as you look at level 2, 3, and 4 is that things start to become more complex as you work through the program. You'll start off by learning about drug formulation and pharmacy practice in more basic terms in level 2. And as you get through to level 4 and you undertake more placement and more training, you will eventually get to the point where you are studying really complex patients, understanding how we care for them using pharmaceutical products, and how we do things like pharmacy research to improve how we use medicines and make better medicines as well. And as I mentioned earlier, you will also be undertaking lots of placement over the course of these years, and we'll take placement, normally from level 2 through to level 4. And again, you'll be out in hospital and in community pharmacy, working directly with professionals and other patients. Unfortunately, once you get to the end of the 4-year MPharm degree, if you want to work as a pharmacist in the UK, it doesn't end there. You will undertake what's called a foundation training year after that, a full placement year, effectively, where you will work with a pharmacist tutor who will teach you more about how to be a pharmacist, how to use your independent prescribing rights, and unfortunately, there's another exam at the end of that year for you as well. So that means that going from starting the program at Queen's and the MPharm program and entering the workforce as a pharmacist will take 5 years in total. But that's everything that you need to do to go and be a pharmacist with independent prescribing rights. So in terms of how you actually get over that first hurdle, get onto the MPharm program, you can see the grade requirements on the slide here, and there are a couple of different ways that you can join us. One of the main ones will be through our partners at Into, and you can see here that we need your high school diploma with some good grades and a recognised foundation program such as the one at Into. There are direct entry approaches and routes for the MPharm program here at Queen's that you can see on the slide there as well. But what I generally advise to students who are thinking of studying with us is to use this address that you can see at the bottom of the slide. That will take you directly to our grades page, allow you to understand a little bit more about the entrance requirements for our program, and that will give you the most up-to-date information when it comes to applying for our program. So please do take a note of that address, and please make sure you have a look at that and work with your contact at the agency here to make sure you know what you need to do. So a lot of students have asked us about the selection interview, and I mentioned earlier on about the changes that we've seen to pharmacy over the last few years, how we've changed our program, and one of the other main changes that we can see now is that in addition to your application, in addition to joining Into, for example, to undertake your foundation year, we have a selection interview process now that will allow us to select students for entry onto the MPharm. And again, I've got another really useful link for you at the top of this slide this time that I would really encourage you to take a note of and to visit, because it will provide you with all of the information that you need to know about our selection interview process. In short though, our selection interview is there to allow us to meet you and identify if you are suitable for entry into the profession of pharmacy. And what that means is, and this is where lots of students panic, is that you don't need to know how to be a pharmacist at the start of this interview. We won't be asking you clinical questions or asking you to do calculations or anything like that. We won't be asking you things about your science knowledge, for example, but we are going to ask you to demonstrate some key characteristics about yourself. So, as you can see in the list here, we'll see how person or patient-centered you are. Do you like people? Do you like to work with them? Do you like to try and help them out? And if so, how have you done that before? Do you know how to solve problems and make decisions, particularly in difficult situations? And what's your thought process around that? Are you a self-motivated learner? Do you identify maybe some weaknesses that you have or gaps in your knowledge and do something to fix that, to improve how you work as a professional or as a student? Can you communicate effectively? Can you discuss things to certain people in certain ways? Can you talk about complex things in a way that people can understand? Because that's the sort of thing that you'll need to be doing as a pharmacist. What about your professionalism? What about your integrity? Can we expect you to come onto the program and be entirely honest the whole time? Study with integrity, not cheat in your examinations, for example? Have you maybe helped other people or stopped other people from doing something like that before? And how did you do that? How did you manage that? And finally, your resilience and your adaptability. Can you handle stressful situations well? Can you deal with complicated situations in a way that will allow you to make sure that you're okay as well? Because that will allow you to do your job better. So those are the things that we're going to look at in our selection interview, and we'll do that by providing you with questions that are either behavioural or situational. So we'll ask you to maybe talk to us about a time where you've done something from this list, or we'll provide you with an example situation and ask you how you would handle that situation if you were involved in it. So the selection interview is a really, really important part of entering onto the MPharm program. It allows us to get to know you better and to pick students who we think are going to perform the best on the MPharm program and as pharmacists in a few years' time. So we'll come back to the School of Pharmacy in a little moment, but what I wanted to talk about first is about our BSc programs and how to work in the pharmaceutical industry as well, because I know that some of you might not necessarily be thinking about working with patients or working in a hospital or a community pharmacy, but you might be more interested in working within the pharmaceutical industry. And here at Queen's, we've changed our pharmacy program, as I've mentioned, but we've also changed our BSc programs as well to make them even more focused on the pharmaceutical industry. So these are the particular courses and career areas that you might want to think about if you see yourself working in the pharmaceutical industry. You might not have thought about this so far, though, so I wanted to take some time to actually talk about what sort of things you might do if you work in the pharmaceutical industry as a pharmaceutical scientist or a pharmaceutical biotechnologist. And like pharmacy, there are lots of interesting areas and things that you can do within these careers. So these are just a very short number of examples of things that you can do. But starting with identifying targets for new therapies, that sounds really complicated. But what it really means is understanding how diseases work and working out the molecular basis of those conditions. Is there a target that we can hit with a drug, with a medicine, that will treat that condition or even cure that condition in certain patients? And if we have a target, that target is absolutely useless if we don't have something to hit that target with. And that's where drug treatments come in. So if you're working in one of these areas, you might be involved in the design of these drugs that will actually hit those targets and cause the effect that we want. And once we've designed them, that is still pretty useless as well, unless we can actually go and make these and make them at an industrial scale so that we can provide them to patients. So if you're working in these areas, you might be involved in these things as well. It's not just about drug treatments as well, however, so you might be involved in designing materials, devices for healthcare. So some of you who are here today might wear contact lenses to help you to see instead of having glasses on. Those are biomedical or medical devices. And there will be pharmaceutical scientists and pharmaceutical biotechnologists who will be working on these materials for these devices to allow us to treat conditions. I did the MPharm program here at Queen's, but my PhD was centered around making new materials that killed bacteria, prevented infection for use within devices. So nothing to do with drugs at all, but centered around medical devices. You might also be working in the likes of characterization as well. So can you identify drugs and their purity? Can you say there's definitely the right amount of drug in a product before it goes to a patient? Because that's obviously very important. And there's lots of other medical research that you might be involved in if you're working within the pharmaceutical industry too. And again, I've only just mentioned a few of the different things that you might do working in the pharmaceutical industry, and there are effectively hundreds, if not thousands, of other types of job or role that you might do in these areas. So if you're thinking about working in these areas, you might be wondering, well, what's in this for me? And that's okay. It's allowed. You're allowed to want to know what you get out of having a job like this, just like pharmacy. And again, just like pharmacy, the pharmaceutical industry needs people who are pharmaceutical scientists and pharmaceutical biotechnologists. And again, those career areas will center around some of those things that I mentioned earlier: design, development of drugs and devices and materials, but also things like quality control, regulation of medicines, being able to advise government agencies about what these medicines contain, what the dangers are of them. Could somebody misuse those medicines for other reasons? And that will control how regulated drugs might be. There are lots of other career areas too within these main areas of pharmaceutical sciences and biotech, but these are some of the key ones that a lot of our graduates move into. So there are lots of benefits to working in the pharmaceutical industry. You've talked about how vital these people are, but you're also working on things that are on the cutting edge. You will be working on new products and drugs and materials and treatments for patients over the time. Okay, no worries at all. 5 minutes, that's grand. I can move on then as quickly as possible. So that's the pharmaceutical industry then. In terms of getting there, our entrance requirements are fairly similar, and I'll provide you with a link to that too. And what you can see here is that level 1 through to level 3, there are increasing complexity in terms of how we move on through the programs, much like the pharmacy degree. And you'll see more information about this through these slides. We also have sandwich courses available for you also, so that you can go and do work placement as well. So to move on then, just to try and make sure that we can move through everything, I'll not spend too much time talking about getting started with Into, because your contact at the agency will be able to provide that to you. But I wanted to spend the last 5 minutes or so talking about why you might want to study with us here at Queen's. And that will really centre around these key things: educational excellence, research excellence, and the facilities that we have. And as you can see here, the School of Pharmacy at Queen's is ranked 39th in the world for pharmacy and pharmacology, and there are hundreds, if not thousands, of schools of pharmacy and pharmacology across the globe. And Queen's University Belfast is ranked 202nd in the world as a university, which means that we're really, really highly ranked both as a school of pharmacy, but also as a university. So you're going to get the best study experience possible. You'll see in this slide, and I'll not spend too much time going through each point just because we are pushed for time, but you'll be able to see some examples here of how we do our education in a really exceptional way. Teaching awards, academic staff who influence how we teach pharmacy and pharmaceutical sciences and biotechnology across the UK and further afield. There are other universities who come to us to understand how to teach these courses better. One thing that I do want to talk about just for a few minutes is that I know that a few of you have been looking to find out more information about our common registration exam, that foundation training year entrance examination. At the moment, unfortunately, you can't find the pass rate for our students for the year 2023, and that's something to do with our regulators. So the UK has a general regulator for pharmacy, but Northern Ireland, which is where Queen's University Belfast is, has its own pharmacy regulator, and they haven't yet released the overall pass rates for the School of Pharmacy here at Queen's yet. What I can tell you is that there are 2 universities in Northern Ireland that teach a pharmacy programme, and the overall pass rate there was 93%. So we have a really exceptionally high pass rate in this examination. We know that. We just don't have the final piece of information for you yet, but we will be able to pass that on as soon as we get it. What I can also tell you though is that the year before, in 2022, our students, in terms of their pass rate, ranked us 5th in the UK for every school of pharmacy. So there's really nothing to worry about when it comes to passing that entrance examination when you're doing your professional study. So you'll see some information about Queen's in terms of the resources and facilities. Queen's has spent millions of pounds developing these resources and facilities to allow you to study to the best possible way. So lots of simulated facilities that you can see in the likes of these images here. You'll be able to walk in and work in hospital wards, community pharmacies, and also enter into digitally simulated environments as well to take you outside of hospitals and communities and work as a pharmacist in lots and lots of different areas. And we're constantly developing these things as we move on too. So a really, really exceptional experience in terms of the staff who are teaching you and the facilities that we offer then as well. Finally, our research is cutting edge. You'll see all of the main areas of research that we deliver here at Queen's and at the School of Pharmacy at Queen's University Belfast. We are ranked 4th in the UK for our research in the general area of health sciences, but we're even more highly ranked in other areas as well. And these researchers are the staff who will teach you on your programs, and you'll be able to do research projects with these staff as well as we move forward. So there's some information here about scholarships. I'll allow your contact at the agency here to provide you with some information about the scholarships that are available through Queen's. And as you can see here, these range from £4,000 through to a reduction across all of your fees for the entirety of your time at Queen's. But please do have a look at these slides for some more information about our scholarships. So there's some information about how you can find out more from us directly. You'll find my email address down at the bottom of this slide as well. So please do feel free to contact me if you do have any questions directly about our programs here at Queen's, and I'll do whatever I can to help. But of course, you can contact your contact at the agency here, but also other staff at Queen's using the askmhls@qub.ac.uk address as well. So thank you very much for your time, for listening to this. I will make sure that we'll pass these slides on so that you can have a look at the information. And again, please do feel free to contact me if you have any questions that I can help with. So thanks very much for listening.
Thank you, Dan. Yeah, thank you for your presentation. Actually, I had one question regarding your university, but